Hello everyone, I'm Subi Shah. I'm a print and broadcast journalist based in London with a specialist in human rights. On today's panel, Protecting Child Mothers in COVID-19 Contexts, we'll be hearing from an exceptional group of advocates and experts on how we can support historically excluded girls, especially child mothers, as the pandemic continues to upend countless lives. We'll discuss the urgent protection needs of girls in post and prolonged COVID-19 contexts, with an emphasis on the intersection of child marriage and maternal mortality. Ever since COVID threw the world into disarray, it was no secret that women and girls would be amongst the hardest hit. As early as April 2020, UN Secretary General Antonio Guterres called for measures to address horrifying global surge in violence against women and girls as lockdowns cause a spiral of economic and social ramifications. Yet here we are, more than a year later, with girls still woefully under-resourced, with limited access to schools and health facilities, continuing to suffer in the greatest ways. Today's panel is organised by Too Young to Wed, a global non-profit organisation whose mission is to empower girls and end child marriage globally. Too Young to Wed focuses its work in areas where child marriage is most egregious and underreported. We'll hear more from Too Young to Wed's founder, Stephanie, later in this discussion. Now I'm going to introduce our fantastic lineup of speakers for today. We have Christy Turlington Burns, founder of Every Mother Counts. Under Christy's leadership, Every Mother Counts has invested nearly $21 million in programs in Africa, Latin America, South Asia, and the United States, focused on making pregnancy and childbirth safe for every mother, everywhere. Before founding Every Mother Counts, Christy received international acclaim as a model representing the world's biggest fashion and beauty brands. Christy has been featured on thousands of magazine covers and was one of Time's 100 most influential people and Glamour magazine's 2013 Woman of the Year. In March 2016, EMC was recognized as one of Fast Company magazine's top 10 most innovative not-for-profit companies. Stephanie Sinclair is a Pulitzer Prize-winning photographer who's used her images to put faces to some of the world's most serious gender and human rights issues. Her 18-year multimedia series, Too Young to Wed, examines the deeply troubling practice of early, forced, and child marriage as it appears in a variety of communities around the world today. Stephanie's series has earned numerous global accolades, including 3 World Press Photo Awards and numerous prestigious exhibitions, including the United Nations 2012 and 2014, and the Whitney Biennial 2010 in New York. Stephanie later shepherded the Too Young to Wed series into a non-profit organization of the same name, and she currently serves as the organization's founding executive director. Domtila Chesang is the founding executive director of IREP Foundation. She hails from the West Pocock County, where female genital mutilation, FGM, prevalence is over 75%. She identifies as a full-time girls' rights defender. Having trained as a high school teacher, Domtila chose to put aside her profession and champion the end of harmful traditional practices in her community, including FGM. She's recognized both locally and internationally for her frontline campaign work and has received a number of awards and recognitions. She founded IREP Foundation, initially called Let's Abandon the Knife in 2010, in support and empowerment of victims of gender-based violence, particularly FGM and child marriage. Chantalle Okondo is a researcher with the Population Council's Kenya office, working with the Reproductive and Maternal Health Programme. Her areas of expertise include women's rights, public health, maternal and child health. She's worked with teams in Kenya, Somalia, Somaliland and Ethiopia on projects seeking to improve the quality, effectiveness and efficiency of efforts to eliminate FGM and child marriage. Christy, if I may, can I start with you? Fast forwarding through your life, after a hugely successful modelling career, you went to college, earned a degree in comparative religion, and met your now husband, actor and filmmaker Ed Burns. You became very involved in campaigning towards better maternal health care. Would you mind telling me what brought you to this personally?
Sure. Hi, everybody. I, for many years, actually have been campaigning around health and wellness. My mother is from Central America, and I've spent most of my life, even around my modeling career, traveling and trying to advocate for of various causes and issues. But maternal health actually was very unique for me in the sense that I became a maternal health advocate the day I became a mother. I have a daughter who's nearly 18 years old, and after the birth of her, I experienced a postpartum hemorrhage, which was something that I hadn't been prepared for, obviously, but also once I had the experience, I dug in a little bit to kind of understand what had happened to me and learned that there's still hundreds of thousands of girls and women who die each year from pregnancy and childbirth related complications. But at that time in 2003, the global estimate was upwards of 500,000. And those numbers really had not budged in decades, which really shocked me. So I really kind of dug in and tried to figure out how that experience would help other people to go into pregnancy better prepared, to advocate for access for equitable, safe, and respectful maternity care around the world. And that led me to start a documentary film, which I started to make called No Woman, No Cry while I was a student at Columbia's Mailman School of Public Health. And that film kind of, became the opportunity and really the thesis, I would say, of my education to better understand the challenges and solutions around maternity care and access to quality and respectful care around the world, which then led me to start the organization Every Mother Counts in 2010.
Christy, what are the facts and figures on maternal mortality or maternal pregnancy and birth complications in the US? And were you surprised by the difference between race and class when it comes to this issue?
Well, it's interesting. I learned about the magnitude of this issue internationally first around the time midway point of the Millennium Development Goals. And when I was learning about the scale of this problem globally, I learned, of course, that the United States was also doing quite poorly. At the time, we were ranked 41st in the world, and today we're ranked 55th. According to the WHO. So the United States is actually progressively getting worse as many countries have started to make significant improvements over the last decade. Today, 2 women die per day here in the United States, which is very different to many countries that have high rates of maternal mortality. However, this is a country where we spend more on healthcare per capita than any other developed country in the world. And we're one of only 2 industrialized countries with a rising maternal mortality rate. So this is something that really should not be. I learned very early on that those who are most vulnerable to maternal death happen to be those that are already the most marginalized in any country where there's a problem around maternal mortality. And so here in the United States, of course, that means that people of color are significantly more impacted by poor birth outcomes for a range of reasons. But I would say most specifically in the last few years, the focus has been on medical racism, institutional racism, a system of healthcare which denies care to certain women, doesn't listen to women in our institutions. Time and time again, you hear testimonies of women who can tell that something is not going right postpartum or in the delivery itself, and they're ignored. They are told to go home. They are essentially not respected. And that has really added to this high rate and rising number of women who are dying in childbirth or who suffer lifelong disabilities as a result to pregnancy and childbirth.
I know you're campaigning very hard, but what else? What is being done on governmental healthcare providers level to deal with this issue?
I would say because of the advocacy of our organization and a number of others, I believe that there is more attention being paid to this issue here in the United States. With a new administration in Washington, and with so many policymakers already introducing legislation around this topic, addressing health disparities, racial disparities in this country. There is a greater awareness, and I would say call out for accountability from our institutions, which traditionally or historically, as you mentioned at the top, have been not caring for certain populations. And so I would say it's clear that there is a need. Many hospitals across the country have implemented better safety protocols around the leading causes of maternal mortality, such as postpartum hemorrhage, sepsis, hypertensive disorders, and the like. And then there is a greater attention to teaching about racial bias in our medical facilities and institutions. We have continued to make many films since the original film No Woman, No Cry. And some of those films, one series in particular called Giving Birth in America, has been sort of implemented across an educational platform along with the Medical School of University of Miami to create curriculum designed for medical students or residents to be looking at and considering the impact of respectful care or disrespectful care, I guess, as it were. So there's a lot of different things happening at different levels. I think, though, across the country, there is a real focus on policy change, significant policy change, and all of this together are really creating the change that needs to happen here in the United States.
So I'd like to bring in Stephanie Sinclair now. Stephanie, can you explain how Too Young to Wed came about?
Thank you so much, Subi. Too Young to Wed started as a campaign, actually, but it came from my background as a journalist. I have been working for about, 20-something years covering conflicts and different sorts of social issues. And in 2003, like Christy, that was a time I really started to encounter girls who were really suffering, and particularly in relation to their social status, as far as they were getting married very young and having birth very young in quicker succession, and basically they were just not being valued for what they could give outside of their bodies, outside of their fertility, their sexuality, and their labor. And so that when I first encountered the issue of child marriage, it was in Afghanistan in 2003. The more I looked into the topic, the more I realized there weren't really a lot of photographs on it. And so there was some great work done by the Population Council, but really you couldn't really connect with those girls. And so it started as a photography project, a photojournalism project. And the more I learned, the more I realized how much I still didn't know and how big of an issue it was. So we did a big campaign with the United Nations, and it traveled to more than 15 countries, the photography exhibit and some short films as well. But eventually I wanted to give back to the communities who were sharing their stories because they were open to change. They shared their stories because they have hope. They share their stories in these difficult times because they want their communities to do better.
It's not just your own photography that is telling these stories. You're giving young girls, young women, the tools to control their own narrative through Too Young to Wed. Can you just explain a bit about how that's happening?
Absolutely. As I was doing more of these photographs, we wanted to have the girls actually tell their own stories as well. So we've done a series of art therapy workshops called the Tahani Photo Workshop that gives the girls an opportunity to learn photography and share their own stories and stories of each other. A lot of them are groups of girls who've been through the same thing. And yeah, we then use the photographs as an advocacy tool, and the girls are very excited about having their stories told in this way. Everyone who graduates receives some sort of scholarship, but they have to give back to society as part of it. And one of the girls wants to have her own workshops with 8 other girls, and they want to travel around doing their own campaigns during the holiday breaks.
Brilliant. Absolutely brilliant. Are you able to tell us perhaps about one particular case study of someone that has been nurtured through Too Young to Wed?
I think the thing that was most difficult for us was during COVID. They closed the schools and the shelters. And so these girls, many of them who had run away from their marriages in the first place, or FGM, female genital mutilation, they had run away from dangerous situations and then were supported. And then we were helping with scholarships. They all got sent back home, regardless of whether they had been reconciled with their families. And so we heard from several of the girls that they were starting to face abusive situations. We ended up sending our team immediately to go house to house to the most vulnerable girls, the ones who were at the most risk. And they went like to over 100 houses. It was like 2,000 miles going to house. And they really worked with the parents to get an agreement that they would make sure that the girls were safe and they were not cut or married during that time. We met with a girl named Deborah. We'd heard that her father wanted to cut her and marry her off. And he was like, I just don't want her, to get pregnant. I'm worried if she gets pregnant, then I'm going to end up now having to support this child too. And it's a shame to that community if she gets pregnant. And so there was a lot of issues. And now she's in school. We're supporting her scholarship fully. There needs to be a lot more education as far as to the girls about sexual and reproductive health, because that seems to be one of the main drivers for a lot of the harmful practices that we are facing.
It must be really difficult trying to change the attitudes of older people who've only ever known this to happen. Is that something that you've found difficult to deal with? And how are you received when you first go into a new place?
I think that once, even in the most conservative societies, I think when they realize that issues like child marriage are really perpetuating the cycle of poverty, they're much more likely to listen. They love their girls. And so when they understand their girls are dying, not because of a curse, but because she's having obstructed labor and there's nowhere to take her that's in a reasonable walking distance, and that it's because she's too young, because her hips aren't wide enough, her pelvic bones aren't wide enough. So, but once they understand that a lot of the social ills that they're facing and a lot of the unfortunate deaths in their families and this like cyclical poverty is related to these issues, they're much more open to listening. They want their standard of living to improve, especially as climate change is starting to devastate some of these areas.
I mean, through sheer bloody-mindedness, you've managed to bring this to the attention of world leaders. What has their attitude been? And are they just saying they support your cause, or are they actively supporting your cause?
Well, I've been working on this topic a long time. I'm very grateful, through partnerships with different organizations. They've had a lot of high-level conversations about the issue. Child marriage is now listed as target 5.3 in the Sustainable Development Goals, so at the United Nations. So they're definitely seeing some progress. And I think that even with a lot of the conversations that are happening, when we have situations like COVID, which is an emergency situation, even with that, girls are still like, I read a statistic that was like 0.2% is spent on gender-based violence prevention in emergency settings. And COVID was definitely an emergency situation. Their issues and the danger they were put in by being in lockdown like this, where families were financially struggling, just wasn't really addressed as much as it should have been. There's still so much work to be done, and it's urgent. It's an urgent issue.
You've just come back from 3 weeks in Kenya. You spent some time in West Pokot. Can you tell me what you witnessed there and just a little bit about your experience?
I just came back from Kenya, and I had the honor of spending a lot of that time with Domtila, who's joined us here today. Yes. And it was not an easy trip. One of the things we worked on was a project supported by the National Geographic Society on maternal health and maternal mortality, actually, because the rates are so high in West Pokot. One statistic said that it was 1 in 5 girls or women and girls die in childbirth there, which is extremely high. Particularly in North Pokot area, there were so many girls who were coming through the dispensaries, and that's not to count all the girls who don't even get there. Because, in some of those areas, it's such a far distance from their house to even the dispensary where they can receive some treatment. And, but the families were very generous with their time and shared their stories with us, again, because they want change in their communities. They want more resources. So I'll let Domtila kind of explain a little bit more about what we saw.
Thank you, Stephanie. Domtila, hello. Can you tell me a little bit about the work that you're doing?
Thank you. I think my name is Domtila Chesang. Like I said, I'm from West Pokot County, Kenya. Most of the time when you say you're from Kenya, people think you come from the city. I don't come from the city. I come from about 9 hours away from Nairobi, which is the capital city. I was born and raised in West Pokot County. I grew up in a community, the Pokot community, that practice FGM. And my community practice what is considered to be the most severe type of FGM, that is type 3 of FGM. Growing up, it was a normal thing for us. I even looked forward to the time I'll be cut myself. When I was 11 years old, I witnessed my cousin being subjected to the cut, because initially we are not allowed to, originally we are not allowed to witness or to participate in the actual cutting. Young girls like myself were only allowed to watch the first bit, which is the celebration only. But since the moment I saw everything that was happening, I changed my mind about the excitement of FGM. And this is how I began my journey that resulted to founding IREP Foundation later on in life. I wanted to challenge what people thought was right in my community. I needed like a stronger and a better platform that's not only my voice. That is how we founded IREP Foundation, which is like a vehicle that we use in the Pokot community to create awareness across West Pokot County, to let people know that FGM is a violation of girls' rights, is a violation of human rights, it's child abuse. What we do as an organization, as a grassroots organization, we sensitize the community, because apart from the fact that West Pokot records a very high prevalence of FGM and child marriages, we also have up to above 67 illiteracy level. So the fact that the community are not educated or are illiterate, it means they are also ignorant to so many other things. So the only way we can be able to help them make informed choices is to empower them with the information, to show them what they are doing to their daughters. That is what we do at IREP Foundation. But besides that, we also create education opportunities for the girls, because once a girl has access to quality basic education, they're able to say no, because FGM is done in my community to adolescent girls, and it's done for the purposes of marriageability. So it's like a prerequisite for marriage. We create opportunities for these girls to get access to education, so that they're able to find their voices and they're able to use their voices to say no to FGM. With the support of Too Young to Wed, what we have done recently is to create a safe space for these children, because as much as we would love to see children being protected and being safe in their own homes, that is not the case in most of the times. Children are sometimes exposed or sometimes they're at even higher risk being in their homes with their families.
We're talking about a practice that goes back as far as the community knows, and it's women that are doing this to their daughters. How are you received by those elders?
So yeah, it's true that FGM child marriages are mostly perpetuated by women. Because I'm from this community and the organization is recognized by the community, I must say that we have never faced any resistance from the community, by the community members, because what we do is for the good and the benefit of the community, and they have already seen the results of our work. So they are supportive, they are receptive, although it also comes with its challenges, but I'm not complaining. I must say that we are getting the support of the community.
That's brilliant. And what about on a grassroots level, even local governments and healthcare providers? How are they working with you?
Okay. There is support and there is a political goodwill at the community level, yes, but it's not enough to end these vices. It's not enough to protect girls from these vices, because despite the fact that the government makes commitment and they have done one or two things, we still continue to witness so many cases of girls being married off at a very tender age, girls being subjected to these very harmful practices. So, but with the authorities, for example, because of our good rapport with the administration and how we conduct our activities, we have received maximum support, especially from the county commissioner, trickling down to the local administration. And I think this is also because of the approach we use. So, and that way, I can say that at least the administration are really trying. And this also comes all the way from the president's directive, who is committed to eradicate FGM and child marriage. But there's still a lot of work that needs to be done by the county government and the national government.
Is there anything that I have missed out that you wanted to talk to us about?
Can just add on to our experience with Stephanie. Thank you for visiting West Pokot and seeing it for yourself. And I also was able to even experience some of the revelations that I was not even aware of in some parts of my community, because West Pokot is it's a vast area and is characterized by very many challenges, because we are one of the marginalized communities in Kenya, like seriously marginalized tribes in Kenya. So there are still so many challenges in my community. I feel this is like a really personal thing for me, because the people that you're talking about are people that I encounter or I meet day to day. These are real people. These are young girls that I've been able to interact with. And even when Stephanie was here, we came across so many underage girls below the age of 16. Some are pregnant, some are already having the baby, some are experiencing complications. We were able to even follow one girl, 14-year-old girl, through her labor when she was in labor, because we really wanted to just tell and see how these girls struggle to even give birth. And that was just one case that made it to the hospital, and eventually she had to go through cesarean. Besides that, there was another girl just the other day, as I was in one of our areas of work, who she lost a baby, and sadly she also lost her life. She did not even make it to the hospital. She lost the baby at home. That is a girl between the ages of 10, 11, 12 there. It's almost normal to see girls losing their lives because of, losing their lives during delivery. That was the story. So this is a real life scenario. I also wanted to just share a little bit about how COVID-19 has impacted our work. It's not been the same as the period before COVID. It's tough. I am telling you, it's very tough. So because obviously COVID-19 regulations have made it difficult for us to move around, access the girls at need, and even for the girls themselves to have access to the services and the facilities has become a real challenge, because now more focus has been shifted towards responding to COVID-19. Girls have been left on their own. Even personally, I'm worried about my girls. I don't know what I'm going to do with them, because they're supposed to go home for the holidays. I don't know whether they're going to be victims of teenage pregnancies. I don't know whether they're going to be subjected to FGM. And before I walked into this session today, I got a phone call, and I was being reminded by one of the villagers that please come and talk to our girls. Some of them might just be forced into FGM. So it's overwhelming. I cannot say all of it, but that is just like the situation around here. It's tough, but we still continue to celebrate the small steps that we are able to make.
I'm going to bring in Chantalle Okondo now. Chantalle, you are a researcher with Population Council Kenya. Do you want to tell us about some of your recent focus areas of work, please?
Yeah, thank you, Subi. And I also want to thank Stephanie and Too Young to Wed for inviting me to participate in this important discussion. My job at Population Council is to understand the circumstances around people's lives so that we can develop programs and policies and other interventions to improve lives. I've been working with Population Council for a few years, and for decades, the Population Council has been at the forefront for research that enhances the lives of women and girls. Just some of the projects that we've done is, our research is informing the Africa-led movement to end female genital mutilation. We have also looked at how disrespect and abuse during childbirth often discourage women from seeking maternal health care that they desperately need. And even in Nigeria, we saw that by providing training to health service providers on the provision of magnesium sulfate, we could reduce eclampsia-related maternal mortality by 68%. So we have a treasure trove of data and evidence on circumstances around young women and girls' lives. And we are also using that data to help inform national and international decision making. My work in West Pokot, this was back in 2018, 2019. Around that time, I was part of a research team that worked on a study looking at the health system response to female genital mutilation prevention and management. For that study, we spoke to policymakers and healthcare providers in West Pokot. We conducted health facility assessments. We also interviewed over 360 young girls and women with FGMC that were seeking reproductive health services. And, we also interviewed Domtila, so I'm kind of also happy and excited to be on a panel with her. And we were able to kind of gather quite a lot of data that spoke to the health system situation in West Pokot.
Okay. Why are the rates so high in West Pokot particularly?
Yeah, you're right. Those rates are quite high. In West Pokot, the maternal mortality rates are at 565 maternal deaths per 100 live births. And this is compared to the national average of 362 maternal deaths per 100 live births. That's 200 more maternal deaths that happen in West Pokot as compared to the rest of Kenya. So there are quite a few reasons why it's so high, and I can't exhaust the list, but some of the issues are, on average, women in West Pokot have 7 children in their lifetime compared to national average of 4. Most of the women deliver at home and are assisted by traditional birth attendants. And unfortunately, only 27% of women in West Pokot have been delivered by a skilled provider, and even less, 2% have had a C-section. Unfortunately, in West Pokot, they have higher rates of teenage pregnancy, so at 23%, compared to the national average, which is 15, so consistently going up and higher than the national average. And then West Pokot, as Domtila and Stephanie have spoken about before, it's one of the regions in Kenya that has historically been marginalized. So there are high rates of poverty, low literacy levels, and it's a vast area. Young women must travel very far to reach primary healthcare facilities. So, my research focused on FGMC. What the type that is practiced is type 3, which is the most severe form. It's essentially closing or narrowing of the vaginal opening. And so this really presents its own additional consequences during childbirth. In our research, specifically when we spoke to these young girls and women, we found that some of the findings were that young girls and women presented with a wide range of birth complications. This included tears on their genitalia, postpartum hemorrhaging. They also needed cesarean sections, and they had long-term complications, including fistulas, scars, and keloids, and even mental or psychological impacts, including trauma and stigmatization. What was interesting was that although some clients received treatment in the first health facility they presented to, many women and girls were referred to higher level facilities because the providers lacked the capacity to address birth-related complications. And that kind of brought on its own challenges. Many of the facilities we went to didn't have ambulances or some way to help the women get to a referral hospital. So they had to not only find money for transport, but navigate this vast West Pokot area to get urgent care. What I also thought was interesting was that there was some cultural aspect to it. So some of the women we interviewed, they talked about if they experienced a complication, the hospital sometimes was the last resort. Some of the people in the community would believe that if you had prolonged labor, it may mean that you had many sexual partners. And so you needed to cleanse the girl first before you would take her to hospital. And other women in the region also just feared cesarean sections because they felt like it could lead to death, or it may limit them from having additional children in the future.
I've touched on this with the rest of the panel, so I'm going to ask you as well. It's very easy for politicians to say, as Domtila was just telling us, we're going to end FGM by 2022. What are you finding? Are politicians sincere?
Well, yes, I mean, they are sincere. However, what we saw with our own research was that a lot of these policies and declarations, commitments, they happen at a national level, and sometimes there's inadequate consultation or inadequate involvement of other stakeholders, people like Domtila, healthcare workers, even county level officials. And so there's also that lag time, when the president made his declaration to now securing funding for this, like by the time this even gets to the facilities level, there's been a change, there's been, staff turnover, getting people to understand the momentum that happened earlier on probably isn't there anymore, or people don't understand what has happened, or there's just sheer ignorance. So,
have you seen any positive interventions? Can you tell me about anything positive that's happened, especially how have things, for example, been adjusted in the light of COVID-19?
We do have a COVID-19 response where we're working on identifying the needs of vulnerable populations and getting the evidence that we need to see what works to guide the response effort, and making sure that this is inclusive and equitable. So it's kind of a bit early days to say now, but we know some of the data that is needed. So our research shows that it's important to reach these vulnerable girls early, so between the ages of 10 to 14, before they get exposed or they have to undergo FGM, child marriage, unintended pregnancy. And so the council does have some research they've led on the Adolescent Girls Initiative in Kenya that's testing out a combination of interventions such as health, violence prevention, wealth creation, and education to determine which ones improve girls' lives the most. In terms of the COVID pandemic and lockdown, clearly education has been hindered. That safe space that people have created with education has been affected. But I think as we slowly get back into it, not losing that focus is also important. And I think with the COVID aspect, I'm sure this has changed considerably given the economic impact COVID has had, and the lockdown would probably isolate a lot of these girls that are in need of urgent or important maternal health services. So that link between the facilities and the community needs to be strengthened, and actors like Domtila are really key in making sure that those hard to reach girls can access these services, or that if it's an issue of being alone, that at least their families could be allowed to come, obviously following COVID-19 guidelines.
What do you want the people watching this interview to learn from it, to take away?
I think it's really important for people to understand this is really a human rights issue at the end of the day. When you think about what any human needs, to treat one with respect, to treat somebody with dignity, to recognize that there is that every life has equal value. That's what I hope that people will take away, and by hearing perspectives from a range of people working at different levels on important critical issues related to women and girls, health and otherwise, people can walk away with a stat in their mind that they can share, or a scenario, or a life, a story. That's how we connect. That's how humanity can come together and make significant change and strides towards making a better life for all.
I was saying now since COVID-19, it's been a double struggle, because now with limited resources and almost nothing coming to the grassroots level. So with all the overwhelming needs from the community, I mean, with no resources at all to be able to respond or to prevent this case from happening, it sometimes can get very frustrating. And many a times for a frontline activist or a frontline advocate like myself, you have to shoulder the burden emotionally, psychologically, physically, and you have to literally, do whatever you can at your own capacity, but it sometimes also affects you as a person.
We have a lot of amazing people like this entire panel who are working hard. Many people are working hard on these issues. I think it's a matter of driving resources, to the grassroots areas, to, direct providers and things like that. And, even if it's hard to do, it's more work to do that, and capacity building for these organizations. I think all of that is helpful in getting the aid that's needed and the support that's needed to these areas that are the hardest to reach.
It's been a fascinating panel, and I hope it's been useful to whoever's listening. I can't thank you enough, Stephanie, for inviting me to take part. Thank you. Christy, Turlington, Burns, congratulations on your project. I'm really interested to hear what happens next with it. Domtila, your account just now was absolutely brilliant, and I can't thank you enough for sharing it all with me, and I hope to stay in touch, in good contact with you as you move on. And Chantalle Okondo, you're doing fabulous work. Thank you very much. Thank you everybody for taking part.
After a necessary but very heavy discussion like the one we just wrapped up, it can sometimes feel overwhelming to think about the solutions to protecting girls and during these very difficult times. But one of the most promising solutions to ending child marriage is education. Education is the single most protective factor against child marriage, and which in turn, it also helps protect girls from early pregnancies and reproductive health complications. I'm delighted to announce a special expansion of Too Young to Wed's flagship education program. Our Leadership Scholarship Program supports girls at risk for and survivors of child marriage, and it creates pathways for them to thrive and achieve their dreams. We are supporting the empowerment of a new generation of young women leaders who will positively transform their local communities. The expansion of this program and the launch of this new fund would not be possible without the support of a true pillar of our organization and Too Young to Wed community. Stephanie Freid-Perenchio is a longtime supporter of Too Young to Wed and is one of our advisory board members. She is a remarkable champion for women and girls. Now I'm going to hand the mic over to the wonderful Christy Turlington Burns to say a few words about our dear friend.
Thank you, Stephanie. I believe that Stephanie Perenchio is who initially introduced us together back, it's been a while now actually, but at an event in Idaho. I met Stephanie probably, maybe 12 or 13 years ago through another mutual friend. And right away, so engaged, so already committed to important work around the world. She's also an incredibly talented photographer in her own right. I've had the good fortune to be able to have her support and advice, but also to travel with her to Guatemala and Haiti. And she's just a phenomenal human being and someone who puts her whole self, her heart leading the way into all that she does. And I know I speak for Every Mother Counts and myself personally, but I know you have the same experience in that without her, this work would look very, very different. So I am just so thrilled to be able to say a few words about her here, and so proud of her for this incredible honor to be named, and to also to know the value of that commitment on the work that you're doing, Stephanie. It's just so meaningful, and I know that firsthand. So congratulations to you both for this incredible connection and incredible work to go on and on from here.
Thank you so much, Christy. That was really wonderful. And it is my true honor today to present the incomparable Stephanie Freid-Perenchio. Stephanie, please join us today.
Thank you, Stephanie, and thank you, Christy.
And thank you so much for being here. Your support for this scholarship, which is officially named the Stephanie Freid-Perenchio Scholarship Fund, just means so much to us. You've been such an incredible supporter of ours over the years. It's an honor to honor you in this way, and to really have you more involved in a direct way, even though you've been on our board of advisors for a long time.
Well, thank you, Stephanie. I mean, your work speaks for itself. You and I started a friendship, I don't know, over 10 years ago. And I think that all the work that you and your team has done over the 10 years has been incredible. And I'm just really happy to be a part of it and to be able to help in any way that I can.
Well, thank you so much. And so I think you should tell people how we ended up, well, how many people we're going to be supporting, how many wonderful girls we're going to be supporting, and how we ended up at that number.
I think right now, I think we're at 45, give or take a few. There's some pretty amazing girls. I think the youngest is 8, if I recall, up to 18. I was just in Kenya with you and had the opportunity to spend a day with all the girls. There's some of the most amazing, beautiful, smart, funny, full of life young girls I've ever met. They have a lot to say, and they have a lot that they want to do in their lives, if it's giving back to their community or being part of a global conversation about empowering women. The other thing too is they have high aspirations for themselves. They want to be doctors and lawyers and journalists. It's so refreshing and nice because it's a part of what is just happening around the world. They want to be a part of the world. So it was pretty incredible. And it was incredible to see them with you and with your team, how much they love and respect you guys and the hard work that you've done. And I don't think any of the girls take any of it for granted.
I'll tell you, after you left, I had the opportunity to meet a couple of their moms and family members. And actually they brought the whole group of women from their community to meet with us. And there was only 2 girls from this one village. And they pulled me aside and they said, just so you know, this is a big deal for us that there's 2 girls from this village going to school.
Wow.
And they said that this isn't something, speaking of not taking for granted, they said, this is a big deal for us. We're not taking this for granted. And we're just so grateful that these girls are having this opportunity. So thank you for being part of this journey with us, Stephanie.
And I'm very humbled by this opportunity, and I'm speechless, basically. So thank you very much.
Thank you very much for joining us, everyone, today. It's been a true honor and pleasure to be with this esteemed panel and to have Stephanie here to share this scholarship initiative with us today. It's really it's such a pleasure to do this work and to meet all the incredible people that I get to work with every day, such as, from partners, funding partners, to girls who are beneficiaries, to all of our teammates. Everybody is just, this is a team effort, and everything that everyone does is changing lives. I'm so grateful for just to be on this journey with everyone here. So thank you so much.